This is known as floor cogs. And the reason why we call it cogs is like cog wheels in, say, a watch, a wristwatch, is toothed wheels that move in concert with each other. One wheel moving clockwise while the other one moves counterclockwise. That's more or less how our body moves through space. When the rib cage goes in one direction, the pelvis goes in the opposite direction. And when they move toward each other, one goes clockwise, one goes counterclockwise. Now you've probably already seen this motion, known as pelvic tilts, but we call it floor cogs just to give you more of a sense of really what it is we're trying to do. Ultimately, yes, we're trying to tilt the pelvis in both directions, but we're also trying to achieve a better connection between the pelvis and the ribs, the pelvis and the head and the ribs, and getting them all working as one integrative unit, which is exactly how we move. So, when beginning the floor cogs, you'll be positioned down on the floor on your back with your knees bent and feet flat, preferably as parallel as you can get them, pointing straight ahead. And don't rely on just the feel of your feet being pointed straight ahead, because oftentimes we'll find ourselves thinking they're pointing straight ahead, but when we actually look at them, one's maybe turned out or turned in or slightly in front of the other. So be sure to use your vision. So while lying on the floor with your knees bent, you're just going to first start out with just checking in with where is the pressure of my body as it relates to the floor. The nice thing is the floor is acting as a straight edge, so it's giving us quite a bit of feedback as to where the contact points are. Where is it that the back of my hips are contacting the ground? Does one feel like there's more pressure while the other one feels like it's lifting off? Does it feel perfectly 50-50 on each side? And where is the weight or pressure in the back of the hips? Is it closer toward the bottom of the buttocks, or is it more up toward the top of the pelvic spine or the lower back? And as you connect with that concept and that feeling, move up to that lower back. Is the lower back in contact with the ground, or do you feel like it's lifted off? And if it's in contact, is it pressing hard, or is it just barely touching? Moving up to the back of the rib cage, does it feel like the shoulder blades and rib cage have more pressure on one side than the other? Just get a general sense of how the body's feeling. Now, in this position, you're going to begin by just tilting the pelvis. We'll call this a forward tilt, where the part of my pelvis here in the front is moving in the direction of my hips or my feet. And then I'll go in the opposite direction and allow the pelvis to move so that the front is moving upward toward my head. And at first, just get a sense of what the quality of motion is like as you tilt that pelvis back and forth. Does one feel natural and just easy to fall into? Does the other way feel like it's having to force itself into that position? Was it being pulled or pushed into it? Just get a sense of how is it that you tilt your pelvis back and forth. As you continue with that tilting, get a sense of what the lower back is doing. Do you feel as if when you tilt forward and this front portion heads south, that the lower back lifts off the ground? And when this portion heads north, that the lower back comes in contact? Now the pelvis is attached to the spine, so we should hope to see some type of relationship there. The spine comes up and attaches to the rib cage. So as the pelvis is moving, can you get a sense of how the rib cage must move in concert with the pelvis? As the pelvis tilts forward, can you get a sense that the rib cage is lifting up and kind of tilting north? And then as the pelvis comes back around, the lower back touches the ground, the rib cage comes down to meet it. So these 2 points begin moving away and moving toward each other. Now the spine continues its journey from the rib cage up to the skull. So is there a connection between the pelvis and the skull? If it's all connected, we'd hope to see that there's some movement. And what you'll most likely find, hopefully, is that when the pelvis moves, so too does the head. In fact, they should move in the same direction at the same time. as you continue with this tilting action, you might want to encourage yourself to breathe in as you feel your lower back lift off the ground, and breathe out as the back comes back down. After you've done this for a minute or so, do a reassessment. Check in once again. Where is the pressure on the underside of your hips? What does the contact of the lower back feel like? What about the back of the shoulders and the back of the ribs? Is there a difference? Has something changed? Don't be surprised if you feel like something has drastically changed, because although you've just been lying and moving the body, you've been doing it against the straight edge of the floor, and you've been doing it in such a way where the joints begin to move in concert with each other, opposing actions. That means the muscle tissue in between gets to experience true length or true shortening at the right time. Give it a shot. Assess yourself before and after and see what that's like.